Hey everyone, today I'm going to be going over 7 public health wins of 2024, some quick thoughts on the election. I'm going to highlight some wins from the Public Health Careers podcast as well as the Public Health Millennial platform. Happy New Year's, or more honestly, I'd say Happy Old Year's Day to you if you're listening to this today. Thank you so much for joining me. It means a lot. Be sure to hit that subscribe button, share this with someone who gets some value with it, and make sure that you're taking time to rest and recuperate and do the things that are important for you to be your best and show up your best in 2025. And I'm definitely there to support you. Let me know how I can support you. Jumping into the 7 public health wins of 2024. Number 1, malaria vaccination. The R21 Matrix M malaria vaccine was rolled out in 17 countries, marking a pivotal step in combating malaria, particularly in regions with high transmission rates. If you didn't know, in 2023, nearly 600,000 people died from malaria worldwide. The deployment of this vaccine marks a pivotal step towards reducing the global malaria burden, with the potential to save countless lives and move closer to the goal of malaria eradication worldwide. Number 2, gene therapy for hearing loss. Gene therapy enabled 5 previously deaf children to gain hearing, showcasing the potential for genetic treatments in addressing sensory impairments. In a trial, 5 out of 6 participants who were born deaf as a result of a mutated O2F gene were able to hear after gene therapy to fix this mutation. Number 3, Rwanda halted the Marburg virus. Rwanda achieved a remarkable public health milestone by halting the spread of the Marburg virus, an Ebola-like disease. This success was attributed to decades of investment in strengthening health and public health systems, combined with the exceptional epidemiological work and effective contact tracing. Rwanda's rapid response and robust public health infrastructure exemplify how preparedness and resilience can combat emerging infectious diseases. Number 4, reduced overdose deaths. The CDC reported that drug overdose deaths fell 3% from 2022 to 2023, a rare bright spot in the century of escalating drug deaths. More recent data also indicates that there were approximately 97,000 overdose deaths in a 12-month period ending June 30, 2024. According to provisional data from the CDC, this marks a 14% decrease from the estimated 113,000 deaths recorded in the previous 12-month period, and a reduction of about 16,000 lives lost. Furthermore, the Drug Enforcement Administration noted a 14.5% decrease in drug overdose deaths between June 2023 and June 2024. Number 5, obesity reduction. A study which tracked 16.7 million adults over the past 10 years found that adult obesity rates dropped from 46% in 2022 to 45.6% in 2023. Although the decrease is slight, it marks the first decline since 2013 in adult obesity rates. The study highlights that the most significant drop was observed among women aged 66 to 75 years old in the southern United States. Researchers suggest that the decline may be because of drugs like Ozempic and Wegovy, which have gained prominence for their effectiveness in weight management. Number 6, firearm violence was declared a public health emergency. Firearm violence was declared a public health emergency by the U.S. Surgeon General, mobilizing momentum to address the leading cause of death for American children. Every day, 23 minors are shot in the U.S., and Americans are 25% more likely to be shot and killed than others in high-income countries. Number 7, the EPA is regulating PFAS, the forever chemical, finally. The EPA's 2024 regulation of PFAS, or forever chemicals, sets a national standard for drinking water safety, reducing exposure for hundreds of millions of people. Water providers must comply within a 3 to 5 year time frame with the goal of preventing nearly 10,000 deaths and mitigating tens of thousands of illnesses. Switching over to the election now. My true thoughts are that this is going to be a very challenging period for many of us. We aren't sure what we aren't sure about at this point in time, but what I can say is that you need to do the things to take care of yourself right now, because health equity work is always going to be difficult. There are always times where strategies and tactics and politics are going to make things even more challenging, but we are all here to do the work of providing and working to create a better country and improve the health of the people that are most vulnerable. So as we enter 2025, I just want you to take some small tips around self-care. So focus on what you can control. Take breaks from social media when you need to. Take on some passion projects that are outside of health equity, outside of public health, and get people in your corner that you can talk to, you can cry with, you can have hold accountable, and just have friends that you can really relate with. And you can join my community. It's free. Just click that link below. The new Health and Human Services Administration will play a pivotal role in shaping the future of public health. And I'm not really too sure what that is going to look like. And people are assuming this and assuming that, but I am going to just wait and see what policies are changing and see how we can work to build and ensure that public health is fortified, traditional and untraditional, because honestly, I am very concerned. In the PH Wins data in 2021, there was a 80,000 public health workforce shortage to deliver foundational public health services. And a lot of that data also pointed to the fact that many individuals were either planning or going to retire or leave the public health workforce. And this is because of a lot of things during COVID, but as well as like feelings of burnout and not being appreciated, being underpaid, and all the other issues that already exist in traditional public health. So there are all these challenges, and now there's a new administration that is going to, I would imagine, create its own challenges, and we will see what that means for people and if people end up staying, if they're going to have the opportunities. But just know that I am here to support you and to think this through with all of you. And with an ear towards resilience, public health professionals, like, we must stand together, we must stand strong together, and we must continue to advocate for the importance of our field, for educating the policymakers that are making decisions and changing the policies that impact so many lives, especially those vulnerable lives. And we have to continue to work to demonstrate the public health return on investment and the value of public health. This will be crucial in securing resources and policies needed to protect the communities, especially the communities that are most vulnerable and most marginalized. And broadly speaking, traditional public health has to work to build cross-sector partnerships better and mobilize grassroots efforts so that they can really amplify the voice of public health, and grassroots can amplify the voice back and forth to ensure that the people that are most impacted have a voice in the public health infrastructure to make decisions and to have a say in how we can have healthier lives together. So looking ahead, elections really do shape the landscape of public health. Not only presidential elections, but state elections and other elections. So as we navigate these changes, the public health community must remain steadfast, ensuring progress while preventing regression in critical areas. Together, we can advocate for healthier, more equitable futures. And I know it's going to be challenging, but we have to stay strong and do this work that's so important to the people that are marginalized and oppressed and don't have the opportunity to live their best healthy life. We need to do that for them, as well as for us and our families and our loved ones. So quick tips here is if you weren't working on building a network using tools like LinkedIn or even Instagram, like highly, this may be the time where you want to start doing that and intentionally building your network, building your brand, really doing the things that are ensuring that your career stability is a priority in your life. And if you work on grant funded positions, start having candid conversations around further grant funds, and also start looking at other opportunities, because as much as you might love your job, there mightn't be the potential for that job in the future. While governmental public health might take a hit from these administrative transitions, I think the perspective, the skill set, and the value that you bring as a public health person with a public health background is very valuable and very transferable. So don't box yourself in. Be open to opportunities and really dig down and figure out what you need to do in this next 3 months as we enter 2025. And last thing I'll say is if you currently work in public health, especially local public health, thank you so much. My heart is with you, and I hope that you're able to stay and do the good work alongside the communities that need you. Shift into some highlights and some brighter topics. So shout out to all of you all. Just want to highlight some of the wins. Like Public Health Careers podcast was a top 25 podcast on the platform that I broadcast through. I would really love to get to the top 10%. So if you can hit that subscribe, share this with a friend, continue to just put this out there and share with people who get some value from it, I would greatly appreciate that. Leave a review as well. In 2024, we released 63 episodes, which was listened to in 126 countries with over 31,000 downloads and almost 4,000 minutes listened. The top 3 popular cities where the podcast was listened to was in Washington, D.C., Chicago, and Seattle. So Washington, I see you. I see you. And on YouTube, we had over 45,000 views and almost 1,000 new subscribers on YouTube in 2024. And I'm really going to be pushing and digging into YouTube in the new year. So if you're listening to this, head across the YouTube channel and subscribe to that as well. And on my LinkedIn personal page, if you're not following me, it's also linked below, Omari Richins, MPH. I got over 1.3 million impressions and over 2,000 engagements on my posts this year. And I'm really excited to continue to post and share content and just share my thoughts on a lot of topics, both public health, health equity, career advancement. So I appreciate you all, and I hope that you all continue to get value from this. The best performing post that I had on LinkedIn, I thought it was something that I can kind of like end this podcast off this with. Public health is not about disease diagnosis or individual treatment. Public health is about improving the societal level determinants of communities. Public health is about creating equitable systems for communities. Public health is about collectivism and community. So feel free to join my community below and know that I am with you, other people are with you, and we are continuing to do this work to improve the health of the people around us. So join the community, say hi, let me know if you want to host an event. If you want to support, definitely subscribe. Share this with someone who gets some value with it. Leave a review and consider making a contribution, whether that's through the links below or buying some apparel on the store. Greatly, greatly appreciate you all. A lot more to come in 2025. Let me know if there's anything that you want to hear from me. Follow in all the places. Happy New Year. Happy Old Year's Day. See you all soon. Peace.